I'm Marcia Brocker, Site Director for Case Management at York Hospital. We're currently producing an SBAR communication video for use with our WellSpan staff. Breakdowns in verbal communication and written communication between healthcare workers are contributing factors in 90% of all serious events to patients. In response, hospitals across the country have been asked to implement a standardized approach to handoff communication. The handoff communication between staff should include a time for each person to ask and respond to questions. At WellSpan Health, we have adopted the SBAR method of communication. SBAR is a standard mental tool to ensure concise yet pertinent clinical conversations. The acronym SBAR refers to situation, background, assessment, and recommendation. More specifically, situation refers to what's going on with the patient and the current reason for communicating. Background is a more concise and focused on the patient's pertinent history. Assessment includes pertinent and timely clinical information, which leads to the overall clinical opinion or identification of a possible problem by the communicator. And recommendation is what you think needs to happen next or what you would suggest to address a concern. Before ending the conversation, both people are given time to question and clarify any issues. To further share the SBAR model, we've included a few examples of less than ideal conversations, followed by a suggested improvement using the SBAR format.
Hello, doctor. This is Nurse Weiner on 8 South. I'm calling about your patient in 6A, Mrs. Smith. You know, the short redhead. She's been complaining a lot about pain, and she's been using loads of morphine, which makes it difficult to assess what's going on. She's restless, and when we get her into a chair, it doesn't seem to be any better. Her labs look okay. However, her oxygen saturation seems to be declining. What do you think we should do?
Quite frankly, I'm going to need more information that you've offered. To start with, what's her current dosing of morphine, and what is her current oxygen level, and what are her current SATs?
The SBAR method would instead sound like this.
Hello, doctor. This is Nurse Weiner on 8 South, and I'm calling about your patient in 6A, Mrs. Dorothy Smith. The situation is that she is complaining of dyspnea at rest, which isn't relieved by changing her position. She is frequently requesting more of her ordered PRN morphine, currently at 8 milligrams PRN every 4 hours. Her background is that she is a 58-year-old woman who is 2 days post-appendectomy, and her significant history is insulin-dependent diabetes and coronary artery disease with a stent placed in one artery 1 year ago. As the day is progressing, she's becoming increasingly more anxious. My assessment shows 87% oxygen saturation on room air, decreased lung sounds on the right side, and visually she is marked distress. Vital signs are respiratory rate 24, pulse 104, blood pressure 115/80, and her temperature is 99.2. My recommendation is that you come to see her immediately or have a resident come immediately. She looks like other patients I've seen who have had a pulmonary embolism. Are you able to be here within the next 30 minutes? Also, would you like oxygen ordered until you arrive?
Certainly. I should arrive in about 20 minutes. In the meantime, watch her closely and...
As you can see, clear communication in a known format works for everyone. The expectations of both the sender and the receiver are met. Here's another example between physicians at change of shift.
Hi, Sue. What a day. Not enough minutes to get the work done. I'll be brief. I got a quick appointment at the work. Mr. Fischel in room 3610 came in this morning with vomiting, dehydration. He hasn't eaten yet. I wrote a few orders for diet and some meds. His H&P is done and dictated. I'm not sure what's brewing with this guy. Give me a call if you have any questions.
All right, well, are you working up any diagnoses yet? What's the plan?
Yeah, he's status post-heart surgery. See you soon.
A better exchange of information using SBAR would be...
Hi, Sue. Time is short this afternoon, so I'll be brief. Mr. Fischel's an 82-year-old in 3610. He's admitted earlier this morning. He looks ill. More importantly, his family states his appearance and behavior are not typical for him. He's 8 days status post-aortic valve replacement. His post-op period was uneventful. He was discharged 6 days after surgery. Today his family brought him to the emergency room. He's got complaints of vomiting over 6 times daily for the last 2 days. His exam's unremarkable except for some right upper quadrant tenderness and some redness at the surgical wound. I've made him NPO except meds, and IV is started with D5. He's hooked up to telemetry with no abnormal findings yet. The cardiac surgeon has been called for a consult. He's had a few spikes in temp to 100. I'd suggest we watch his eyes and nose throughout the night and settle his stomach. Maybe you can start some clear liquids tomorrow if he settles. After cardiology visits, we may want to consider a right upper quadrant ultrasound tomorrow morning. Keep an eye on his labs. I'm thinking there may be a problem with the gallbladder versus a post-op infection. Do you have any questions before I leave?
No, but thanks for the information. I'll keep an eye on the wound drainage.
So what have we learned? Firstly, concise communication helps everyone, staff, physicians, and more importantly, the patient. SBAR communication has demonstrated at many hospitals that pertinent communication by all professionals is appreciated, whether sending or receiving information. Staff members using SBAR are empowered and appreciate the impact they have by providing important information and recommending solutions based on assessments. The SBAR format can be used when the patient's change in condition warrants, at handoffs between shifts and staff, and at transfers between hospitals and departments. So please consider using SBAR format in your conversations. And when another person uses SBAR, thank them for the clear communication.